121. A nurse is delegating tasks to an unlicensed assistive personnel, UAP. What task should the nurse delegate? A. Assessing a patient's pain level. B. Administering medications to the patient. C. Taking vital signs on a stable patient. D. Teaching a patient about a new diagnosis. Answer. C. Taking vital signs on a stable patient. Rationale. Taking vital signs on a stable patient is within the UAP scope of practice. 122. A patient is admitted for an exacerbation of heart failure. Which of the following interventions should be prioritized? A. Administering diuretics as prescribed. B. Monitoring the patient for signs of dehydration. C. Restricting the patient's fluid intake. D. Encouraging the patient to ambulate. Answer. A. Administering diuretics as prescribed. Rationale. Diuretics are critical in managing fluid retention and reducing the workload on the heart in heart failure. 123. A nurse is caring for a patient with an indwelling urinary catheter. Which of the following actions is essential to prevent catheter-associated urinary tract infection, CAUTI? A. Clean the catheter insertion site with alcohol every shift. B. Keep the catheter bag above the level of the bladder. C. Change the catheter every 48 hours. D. Ensure the catheter tubing is free from kinks and the drainage bag is below the bladder. Answer. D. Ensure the catheter tubing is free from kinks and the drainage bag is below the bladder. Rationale. Keeping the drainage bag below the level of the bladder and free from kinks reduces the risk of infection. 124. A nurse is caring for a patient who is receiving oxygen therapy. The nurse observes that the patient's oxygen saturation is 88%. What is the priority action? A. Increase the oxygen flow rate. B. Assess the patient's respiratory status. C. Administer a bronchodilator. D. Notify the healthcare provider. Answer. B. Assess the patient's respiratory status. Rationale. Before changing the oxygen flow rate, the nurse should assess the patient's breathing pattern and other symptoms. 125. A nurse is caring for a patient with a newly placed peripherally inserted central catheter, PICC. What should the nurse do first before using the PICC line? A. Flush the line with saline to ensure patency. B. Assess the catheter insertion site for signs of infection. C. Confirm the placement of the PICC line with an X-ray. D. Administer the prescribed medications through the line. Answer. C. Confirm the placement of the PICC line with an X-ray. Rationale. Proper placement of a PICC line must be confirmed with an X-ray before use to prevent complications, such as embolism or incorrect placement. 126. When caring for a patient receiving chemotherapy, what is the priority nursing intervention? A. Encourage the patient to rest and avoid physical activity. B. Provide a high-protein, high-calorie diet. C. Monitor the patient for signs of infection. D. Educate the patient on the importance of daily exercise. Answer. C. Monitor the patient for signs of infection. Rationale. Chemotherapy suppresses the immune system, making patients more vulnerable to infections. Monitoring for signs of infection is a priority. 127. The nurse is caring for a patient who is at risk for a stroke. Which of the following interventions is most appropriate? A. Encourage the patient to consume a high-sodium diet. B. Promote smoking cessation and weight loss. C. Restrict all fluid intake to prevent fluid overload. D. Encourage the patient to remain sedentary to reduce stress. Answer. B. Promote smoking cessation and weight loss. Rationale. Smoking and obesity are major risk factors for stroke, so promoting lifestyle changes like smoking cessation and weight loss can reduce the risk. 128. A nurse is caring for a patient who is receiving 4 fluids. The nurse notices the 4 site is swollen and red. What is the first action the nurse should take? A. Remove the 4 and apply a warm compress to the site. B. Notify the healthcare provider immediately. C. Apply cold compresses to reduce swelling. D. Adjust the 4 flow rate to reduce swelling. Answer. A. Remove the 4 and apply a warm compress to the site. Rationale. swelling and redness at the foresite indicate possible phlebitis or infiltration. The fore should be removed, and warm compresses may help alleviate the symptoms. 129. A nurse is caring for a postoperative patient who is receiving opioid pain medication. The nurse notes that the patient's respiratory rate is 8 breaths per minute. What is the priority nursing intervention? A. Administer naloxone as ordered. B. Stimulate the patient to breathe deeply. C. Reassess the patient's pain level. D. Notify the healthcare provider immediately. Answer. A. Administer naloxone as ordered. Rationale. A respiratory rate of 8 breaths per minute suggests opioid overdose, and naloxone is the antidote to reverse the effects of opioids. 130. The nurse is preparing to discharge a patient who has a new diagnosis of diabetes mellitus. Which of the following instructions should the nurse include in the discharge teaching? A. You should avoid eating carbohydrates. B. You need to monitor your blood sugar regularly. C. It's fine to skip meals if you're not hungry. D. You should avoid exercise until your blood sugar levels stabilize. Answer. B. You need to monitor your blood sugar regularly. Rationale. Regular blood sugar monitoring is essential in managing diabetes and adjusting treatment plans as needed. 131. A nurse is caring for a patient who is receiving a blood transfusion. The nurse observes signs of an allergic reaction, including rash and itching. What should the nurse do first? A. Stop the transfusion and notify the healthcare provider. B. Continue the transfusion and administer antihistamines. C. Administer oxygen and prepare for anaphylaxis. D. Flush the foreline with saline to dilute the blood. Answer. A. Stop the transfusion and notify the healthcare provider. Rationale. The nurse should immediately stop the transfusion if an allergic reaction is suspected and notify the healthcare provider for further instructions. 132. The nurse is caring for a patient with an abdominal wound. Which of the following interventions is appropriate to prevent infection? A. Apply a dry dressing without touching the wound. B. Change the dressing every 72 hours, regardless of appearance. C. Clean the wound with hydrogen peroxide daily. D. Perform hand hygiene before and after dressing changes. Answer. D. Perform hand hygiene before and after dressing changes. Rationale. Hand hygiene is crucial to prevent the introduction of pathogens during wound care. 133. A nurse is caring for a patient who is receiving warfarin Coumadin therapy. Which of the following is the most important to monitor? A. The patient's blood pressure. B. The patient's platelet count. C. The patient's international normalized ratio, INR. D. The patient's temperature. Answer. C. The patient's international normalized ratio, INR. Rationale. Monitoring the INR is essential in ensuring that the patient's warfarin dosage is therapeutic and within the desired range to prevent bleeding complications. 134. A patient who is receiving a diuretic for hypertension is experiencing dizziness. The nurse should assess which of the following? A. Serum potassium level. B. Serum sodium level. C. Urinary output. D. Electrocardiogram, ECG. Answer. A. Serum potassium level. Rationale. Diuretics can cause electrolyte imbalances, especially hypokalemia, which can lead to dizziness and other symptoms. 135. A nurse is caring for a patient with a wound infection. The patient's vital signs are temperature 100.2 degrees Fahrenheit, heart rate 88 BPM, and blood pressure 110/70 mmHg. What should the nurse do next? A. Administer antipyretics and monitor vital signs. B. Document the findings as normal. C. Notify the healthcare provider immediately. D. Administer for fluids and monitor urine output. Answer. A. Administer antipyretics and monitor vital signs. Rationale. A low-grade fever is common in infection. Administering antipyretics and monitoring vital signs is appropriate. 136. A nurse is teaching a patient about self-care for a chronic illness. Which of the following is an essential component of patient education? A. Encourage the patient to self-diagnose symptoms. B. Provide written materials only and avoid discussion. C. Ensure that the patient understands how to manage their condition. D. Emphasize the use of medications without addressing lifestyle changes. Answer: C. Ensure that the patient understands how to manage their condition. Rationale: comprehensive patient education should include both medication management and lifestyle changes to effectively manage chronic conditions. 137. The nurse is caring for a patient who is receiving postoperative pain management. The patient expresses fear of becoming addicted to the pain medication. What is the nurse's best response? A. Will only give you pain medication when absolutely necessary. B. Addiction is not a concern for people who take pain medication as prescribed. C. You should avoid pain medications if possible to reduce the risk of addiction. D. The healthcare team will closely monitor your pain medication usage to ensure safety. Answer: D. The healthcare team will closely monitor your pain medication usage to ensure safety. Rationale: it's important to address concerns and provide reassurance that pain management will be carefully monitored. 138. A nurse is caring for a patient who is receiving continuous enteral feeding. What should the nurse do before administering medications through the feeding tube? A. Flush the feeding tube with 30 milliliters of water. B. Administer the medications without any preparation. C. Mix medications with the feeding formula. D. Clamp the feeding tube and allow the patient to rest. Answer: A. Flush the feeding tube with 30 milliliters of water. Rationale: flushing the tube before administering medications ensures patency and prevents clogging. 139. A nurse is caring for a patient with a history of alcohol use disorder. The patient is showing signs of withdrawal. What should the nurse prioritize? A. Provide a calm, supportive environment. B. Monitor vital signs closely for signs of delirium tremens. C. Administer high-protein foods to prevent hypoglycemia. D. Encourage the patient to exercise to reduce anxiety. Answer: B. Monitor vital signs closely for signs of delirium tremens. Rationale: delirium tremens is a serious complication of alcohol withdrawal that requires close monitoring and intervention. 140. A nurse is caring for a patient who is at risk for deep vein thrombosis, DVT. Which of the following interventions should the nurse implement? A. Encourage the patient to remain on strict bed rest. B. Apply compression stockings as prescribed. C. Limit the patient's fluid intake to prevent swelling. D. Place the patient's legs in a dependent position to promote circulation. Answer: B. Apply compression stockings as prescribed. Rationale: compression stockings help improve circulation and reduce the risk of DVT. 141. A nurse is caring for a patient who has undergone a total knee replacement. Which intervention is a priority in the immediate postoperative period? A. Encouraging early ambulation. B. Providing a high-protein diet. C. Administering opioid analgesics. D. Monitoring for signs of infection. Answer: A. Encouraging early ambulation. Rationale: early ambulation helps prevent complications like deep vein thrombosis and promote circulation. 142. A nurse is caring for a patient who is receiving chemotherapy and has developed mucositis. Which intervention is appropriate? A. Rinse the mouth with alcohol-based mouthwash. B. Apply a moisturizing agent to the lips. C. Encourage the patient to eat spicy foods to stimulate appetite. D. Discontinue chemotherapy immediately. Answer: B. Apply a moisturizing agent to the lips. Rationale: moisturizing the lips helps prevent cracking and discomfort due to mucositis, a common side effect of chemotherapy. 143. A patient with a history of asthma is admitted to the hospital with shortness of breath. The nurse notes that the patient is using accessory muscles to breathe. What is the priority action? A. Administer a beta-agonist inhaler as prescribed. B. Encourage the patient to take deep breaths. C. Increase the oxygen flow rate. D. Perform a chest X-ray to assess for lung pathology. Answer: A. Administer a beta-agonist inhaler as prescribed. Rationale: beta-agonist inhalers are used to relieve bronchospasm in asthma, which is the cause of the patient's shortness of breath. 144. The nurse is caring for a patient with chronic kidney disease. The nurse should be most concerned if the patient's lab results show which of the following? A. Increased serum creatinine. B. Decreased white blood cell count. C. Decreased serum albumin. D. Increased hematocrit level. Answer: A. Increased serum creatinine. Rationale: elevated serum creatinine levels are a key indicator of impaired kidney function, and the nurse should be concerned about potential kidney failure. 145. A nurse is caring for a patient with a history of stroke. The nurse observes the patient is unable to raise their arm on the left side. What should the nurse do first? A. Notify the healthcare provider. B. Reassess the patient's neurological status. C. Administer pain medication as prescribed. D. Encourage the patient to perform arm exercises. Answer: B. Reassess the patient's neurological status. Rationale: the inability to raise the arm may indicate a change in neurological status, which requires further assessment and timely intervention. 146. A nurse is preparing a patient for discharge after hip replacement surgery. Which of the following should the nurse include in discharge teaching? A. You should avoid any weight-bearing activities for the next 12 weeks. B. You will need to wear compression stockings for the first 48 hours. C. You should elevate your leg to reduce swelling and pain. D. You should resume driving immediately once you feel comfortable. Answer: C. You should elevate your leg to reduce swelling and pain. Rationale: elevating the leg helps reduce swelling and pain postoperatively and promotes healing. 147. A nurse is caring for a patient with a history of diabetes mellitus who is receiving insulin therapy. The nurse notes that the patient's blood glucose level is 50 milligrams per deciliter. What should the nurse do first? A. Administer insulin as prescribed. B. Administer oral glucose or a glucose-containing beverage. C. Increase the patient's fluid intake. D. Call the healthcare provider immediately. Answer: B. Administer oral glucose or a glucose-containing beverage. Rationale: a blood glucose level of 50 milligrams per deciliter indicates hypoglycemia, and the nurse should administer glucose to raise the blood sugar level. 148. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is receiving oxygen therapy. The nurse should monitor for which of the following complications? A. Hypercapnia. B. Hypocapnia. C. Hypokalemia. D. Hyperkalemia. Answer: A. Hypercapnia. Rationale: patients with COPD are at risk for retaining carbon dioxide, hypercapnia, due to impaired gas exchange. 149. The nurse is caring for a patient who is being discharged after treatment for pneumonia. Which of the following should the nurse include in the discharge instructions? A. You can return to work immediately. B. You should rest and avoid physical activity for at least 3 to 4 weeks. C. Complete the full course of antibiotics even if you feel better. D. You can discontinue antibiotics when you no longer have a cough. Answer: C. Complete the full course of antibiotics even if you feel better. Rationale: completing the full course of antibiotics ensures the infection is fully treated and reduces the risk of relapse or resistance. 150. A nurse is assessing a patient with a pressure ulcer. Which of the following is the most appropriate method to assess the stage of the ulcer? A. Measure the depth of the ulcer using a sterile ruler. B. Assess the color of the wound bed. C. Perform a sterile culture to identify infection. D. Use a wound classification scale to categorize the ulcer. Answer: D. Use a wound classification scale to categorize the ulcer. Rationale: a wound classification scale, such as the Braden scale, helps to assess and stage pressure ulcers based on depth and other characteristics. 151. A nurse is caring for a patient with a diagnosis of hypertension. Which of the following lifestyle modifications should the nurse recommend? A. Decrease physical activity. B. Increase salt intake. C. Limit alcohol consumption. D. Limit fluid intake. Answer: C. Limit alcohol consumption. Rationale: Limiting alcohol intake helps to manage blood pressure and reduce the risk of complications from hypertension. 152. A nurse is caring for a patient who has a history of seizures. The patient is receiving phenytoin dilantin therapy. Which of the following is the priority nursing intervention? A. Monitor the patient for signs of phenytoin toxicity. B. Encourage the patient to take the medication on an empty stomach. C. Instruct the patient to avoid taking vitamin D supplements. D. Administer the medication with grapefruit juice to increase absorption. Answer. A. Monitor the patient for signs of phenytoin toxicity. Rationale. Phenytoin toxicity can occur, and it is important to monitor the patient for signs such as ataxia, nystagmus, and slurred speech. 153. The nurse is caring for a patient with a urinary tract infection, UTI. Which of the following is the most important intervention to prevent the spread of infection? A. Encourage the patient to drink large amounts of fluids. B. Teach the patient how to properly clean the genital area. C. Administer antibiotics as prescribed. D. Provide frequent perineal care. Answer. D. Provide frequent perineal care. Rationale. Frequent perineal care is essential to prevent the spread of bacteria and promote hygiene in patients with UTIs. 154. A nurse is caring for a patient who is receiving a blood transfusion. The nurse observes that the patient is having chills, fever, and tachycardia. What is the priority action? A. Stop the transfusion and keep the foreline open with normal saline. B. Administer acetaminophen to reduce fever. C. Continue the transfusion at a slower rate. D. Notify the healthcare provider and continue monitoring. Answer. A. Stop the transfusion and keep the foreline open with normal saline. Rationale. Chills, fever, and tachycardia may indicate a transfusion reaction, and stopping the transfusion immediately is the priority action. 155. A nurse is caring for a patient with a history of asthma who is experiencing an acute exacerbation. The nurse administers albuterol via a nebulizer. What should the nurse assess immediately after the treatment? A. Respiratory rate and lung sounds. B. Blood pressure and pulse rate. C. Oxygen saturation and pulse oximetry. D. Skin color and capillary refill. Answer. A. Respiratory rate and lung sounds. Rationale. After administering albuterol, the nurse should assess for improvement in the patient's breathing and lung sounds to determine the effectiveness of the treatment. 156. A nurse is caring for a patient with a nasogastric tube, NGT, in place. Which of the following interventions should the nurse implement to prevent complications? A. Reposition the tube every 24 hours. B. Check for proper tube placement before each feeding. C. Flush the tube with 30 milliliters of air before and after use. D. Clamp the tube for 1 hour after feeding. Answer. B. Check for proper tube placement before each feeding. Rationale. Verifying proper placement of the NGT ensures the tube is in the correct position and reduces the risk of aspiration. 157. A nurse is caring for a patient who has a colostomy. The nurse should teach the patient to avoid which of the following foods? A. Apples and bananas. B. Corn and popcorn. C. Carrots and green beans. D. Rice and potatoes. Answer. B. Corn and popcorn. Rationale. Corn and popcorn can be difficult to digest and may cause blockages in the colostomy. 158. A nurse is caring for a patient who is post-laparoscopic cholecystectomy. The patient is complaining of shoulder pain. What is the most likely cause of this pain? A. Bile leakage. B. Gas from the laparoscopic procedure. C. Gallbladder infection. D. Hemorrhage at the incision site. Answer. B. Gas from the laparoscopic procedure. Rationale. Shoulder pain after laparoscopic surgery is commonly caused by the gas used during the procedure, which can irritate the diaphragm. 159. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. The nurse notices that the TPN bag is empty and the new bag has not arrived. What should the nurse do first? A. Administer dextrose 10% in water via 4. B. Contact the pharmacy immediately. C. Hang normal saline until the new bag arrives. D. Increase the rate of the TPN infusion. Answer. A. Administer dextrose 10% in water via 4. Rationale. To prevent hypoglycemia, dextrose should be administered until the new TPN bag is available. 160. A nurse is caring for a patient with a history of smoking and chronic obstructive pulmonary disease, COPD. Which of the following is an appropriate long-term goal for this patient? A. Quit smoking within 6 months. B. Improve oxygen saturation levels during exercise. C. Decrease sputum production. D. Increase respiratory rate. Answer. B. Improve oxygen saturation levels during exercise. Rationale. Improving oxygen saturation during exercise is a realistic long-term goal for a COPD patient and can help maintain functional capacity.